Well, hello, everybody, and welcome to this episode of the podcast show. My very special guest is Dr. Andrea Moore. Now, she's a mom, she's a wife, and she's a recovering health perfectionist. I love that initial description. She's recovered from lots of stuff in her life, including chronic pain, post-concussive syndrome, anxiety, depression, ADD, and lots more. And she was only 26 when she managed that. So, wow, that's quite an achievement. But then she went on, she became a doctor of physical therapy and also an orthopedic certified specialist and a nutritional therapist and a life coach and a ton of other things. So she's definitely the person to be listening to today, I think. She's telling me she's now in Kentucky after moving south from up here in the Northwest. She was in Seattle before. And now she's got an amazing life with her family and she does all her work online. So marvelous. So welcome, Andrea. I've said a lot about you, but it's great to see you. Great to welcome you. And let's have fun today and talk about chronic pain and how do you heal it? So where do you want to go from here?
Well, first off, thank you so much for having me. It's an honor. I'm excited to be here with you. And oh gosh, where do we go from here? That's a big question. And like you said, I do a lot and I have, tackled a whole lot of different areas because it's so needed, because as I'm sure your listeners know, chronic pain is so complex. There is no, one cure. There is no one thing that does it. And it's really was my own journey that led me to be like, okay, physical therapy is really helpful for this set of things, but it's not helping me in this area. And well, my pain's still going on. So, well, let me try some nutrition. Well, then I was struggling with having issues with implementing the nutritional things I was learning. And no one tells you what to do when you kind of know, quote unquote, what to do, but can't quite do it. And so that's where I went really deep into the mindset work. And I could go on and on about all the other areas, but it's really just integrating it all together because ultimately, again, chronic pain is complex. We have to address it from many different areas. And that's really what I try to do at the end of the day is looking at the person that is in front of me, taking into account their life, their system, their body, their experiences, and being their guide really is about that, is helping them turn inwards to help discover what is going to be the best next steps for them.
Wonderful. Well, I love your journey. It's very akin to my own over the last 5 years and having gone through these different areas as well. So let's dive in to the person, right? Just our listeners are thinking, okay, what about me? How can you help me? And let's dive into maybe some personality types that we have that is congruent with pain. So what's the commonest personality type that you see with chronic pain?
I'm a huge believer in that whole, we tend to see the person that we most, we're sent on the universe to treat. And so for me, the biggest personality I see is a very successful, very high functioning woman who is a perfectionist, type A personality, and oftentimes has been trying to hide her pain, work through her pain, and has also done almost every single thing possible, has a list 3 pages long of treatments she's tried. So that is my most common personality type. A lot of her friends might not even know how much she is struggling with pain. And it's slowly worsening. It's slowly getting to the point where she can no longer hide it, can no longer ignore it. And she's come to this place where like enough is enough, but she doesn't know what to do because she's already tried everything. So she's so desperate for to get better, but it has kind of felt like she's running out of options.
Yeah, very well put. I find that these type of people do not have a problem with motivation, right? No. They're the epitome of motivation and achieving goals. And, when we think about the tools and all the things that we can get up to try and help this, we are at the end of the day left with ourselves. So yeah, we may be doctors, where there may be therapists, there may be nutritionists, but at the end of the day, They're only there to guide and help the
Mhm.
patient and the client. So let's look at personality. How do people like go, well, okay, yeah, that's me, Andrea, but how do I help that? Like, this is just who I am, surely, what do you say to that?
Well, it's such an interesting thing because so often people associate perfectionism or even like stubbornness or, oh, I just can't get better or whatever it might be as personality types, when really it's societal programming. It
Mm,
was oftentimes a mechanism and a very, very adaptive mechanism that they learned through childhood for whatever reason, or even adulthood. It really can happen at any time.
mm,
And a lot of things that people associate with personality traits, if it's not something that's actively helping you live your best life, chances are it's really not a personality trait, or the life you're living isn't aligned with something that truly is you. So it could go either or, but perfectionism is not a personality trait. It's a taught thing, or it was, again, very adaptive. And so we want to be so compassionate and thankful and appreciative of it because it has probably gotten this person so many wonderful things in their life and has
yeah,
probably brought a ton of safety and gifts
yes.
until it isn't, or maybe just in this one area of their life it isn't. Maybe it's really serving them in other areas, and in that case it's totally fine, right? We want some perfectionists in our life. We want whoever's designing our airplane to be a perfectionist, right? We need, like, it is a trait that has a lot of good things associated with it. But like everything, anything to an extreme or kind of in the wrong place at the wrong time is a problem, right? Like a stop sign in the middle of the highway is a problem, but a stop sign well placed is very helpful. So it's
Okay,
really
so how do we, okay, so
about.
I'm the patient now. Let's do some role play. So I'm the patient, I'm a perfectionist, and I am. So how do I change this?
Yeah, we got to take some steps between going before we try to change something,
Right.
because we really cannot change anything out of this place of, I need to get rid of it, I want to push it away, I don't want this anymore.
Okay.
And so it's really always taking these steps back. And like I said, first bringing it into this place of understanding
Yes.
why it's there in the first place,
Yes.
understanding how it's currently bringing safety to our nervous system
Mm,
in some ways, and bringing this appreciation. And only when we're in this place of full appreciation can we focus on really then turning inwards to ask,
mm,
what's the better alternative that's more aligned with me, that's truly me,
mm,
and going there. So a lot of times you want to get rid of stuff and push things away, but if there's nothing to replace it, or there's
yeah.
no other patterns to learn, you can't just leave a void. There's no voids in the body, right? That doesn't work that way.
Mm,
So sometimes it's actually learning all kinds of new patterns, different ways of thinking, and slowly it's almost like rebuilding a bridge over an old bridge that is rickety and isn't
mm,
quite working anymore, but you still need a bridge, right? Maybe it's good enough, it's just safe enough, it works well enough for some cars to pass,
mm,
and then they're building this brand new beautiful bridge, and then finally when it's
mm.
all complete and the cars can be like, okay, that one is safe, and then they can take a different route. So it's never really about pushing away, shoving away. It's really entering in something, another pattern that works even better.
Mm. And I love how you mentioned the role of gratitude and appreciation and the function. It served a huge function.
Yeah.
But now we've got new needs, new goals, new healings to discover. And by having the basis of the heart, or an attitude of gratitude, or a consciousness of the heart, then we can stimulate that parasympathetic, and therefore the part of the nervous system that allows truly us to bring balance. And how much success are you finding with your clients when you do this?
A lot of success. With my clients, we're taking the long road. We
Yeah.
don't do quick fixes. We're really addressing the root of the problem.
Yeah.
And like the root of what is causing this nervous system sensitization in the first place, which is
Yeah.
often these thought patterns, belief patterns, that can lead, I mean, really just being in that perfectionist mindset can lead to just tension in the body. You know, you walk into a room that's not perfectly cleaned as the way you want it, or someone's, you know, you've delegated out a task and someone screwed up, you can just feel your whole body tense, just as a very like, you know, clear reaction that people can associate with how perfectionism can really affect their muscles and their body.
Mm.
So it's, you have a lot of success when you're getting at the root and really diving in deep and not just looking for a quick fix. And don't get me wrong, nothing is wrong with quick fixes, because sometimes when you're in pain, you just need relief. And I actually do incorporate some, like, here is something you can do right in the moment with my clients, because that is so important. But it's really a long haul, slow and steady, because perfectionism often comes with a very all or nothing personality. And like you said, highly motivated. And so what you'll often see is this like huge drive to like, all right, I'm going to do everything. I'm going to do all the things you're telling me. I'm going to do them perfectly. I'm going to do them really well. And then they burn out. And so we need this long haul to be able to go slow, steady, really building in these new patterns that can be sustainable and not lead and like actually just honestly in a way enable perfectionism when we're trying to just load them up with quick fix techniques.
Can you give us an example of maybe a client you've had recently that their life is transformed because of this?
Yeah. So I'm working with a woman right now, and she's an entrepreneur, amazing woman, and she came to me for hip pain. And one of her biggest complaints in areas where it was really starting to limit her life was in being able to exercise. It was just something she really loved. And it's like, yeah, but you know, it was one of those things that bothered her a lot during the day, but she could ignore it. She could get through it, kind of thing. But it wasn't allowing her to run, which was a form of stress relief, right? And so now you're seeing this become an issue. So it's one of those things that, you know, could seem like this really simple hip pain on the surface, but it ended up being linked to all sorts of trauma. And just, yeah, really, really deep rooted emotional trauma, sexual trauma. And in just trying to address it, we've healed so many other areas, and she's had so many other improvements in her life that she didn't even see coming and signing up with me. Because ultimately, the way I look at pain is it's a messenger. It's the body delivering, hey, I need this to be healed and pay attention. And the body just sometimes doesn't have any other way of delivering a message, right? Because how else does it really talk to you? So in this pain that she was having, it was really inviting all of these things to get healed. It was finally telling her, hey, I'm ready to address this. I'm ready to bring up these issues and heal them. And so she's just, you know, seeing so many other improvements in her life. She's running again. She's able to exercise again. And she has a lot of other healthy now, like coping mechanisms for stress, buffering stress, and dealing with scenarios that come up. And yeah, it's really fun to see.
Awesome. I love it. I love it. It's definitely a theme that I've been focused on myself with the last several years of practice in this metaphysical or emotional, mental, or under the surface, the subconscious layers of our being, where it just communicates, as you said, it's a message. It's like a message or a messenger to us that there's something not quite right. And yeah,
sorry, my internet cut
no, it's such a huge subject, and it's so tricky because nobody knows about it, really.
Yeah.
You know, you're not going to hear that from your physical therapist. You're probably not going to hear it from your family doctor. You know, you're certainly not going to hear it from a chiropractor unless they've trained in this, or Massage therapists, because they're not trained, or they're not allowed to talk about stuff like this. They don't have the time or the expertise. So, but yeah, it's all of our life is accumulation of events, and it could be something simple like you're 2 years old and you've got a new brother, and all of a sudden mom's with the little one, and you feel like left out, and some simple things that accumulate over time, and they can be huge traumas, like you've mentioned. I've got patients who've been in wars and seen parents suffer and family members die in front of them, and just as kids, horrific stories. But all of it is like an accumulation in the mental emotional body, and it's trauma and it's stress, and it's programmed us, right? These perfectionist tendencies, because we need to feel like we're pleasing someday, and we need to do it right, and because we feel safe within ourselves. But these layers need to come off, and people really need to be open to it. Any suggestions for people listening right now that are thinking, well, I don't think so, I'm more like, I've got degenerative disc disease in my x-ray, and that's what my doctor's been telling me for years, and that's what my problem is. But anything to open people's hearts to the reality of what we're talking about.
It's a great question, and just especially for the scenario that you just mentioned of somebody who might have a very like, this is what it shows, or I had this injury. The reality is this is your life. And what we know about pain is that pain, again, is complex, and ultimately pain is always real. Let me first say that. Whatever you're experiencing is real, and it is always created by the amount of threat your brain is determining is happening. So even in the case of let's say you just broke your leg, or I like to use the example of like you just got stabbed in the thigh with a knife, okay? As an analogy, you can even use this type of like mind body, like meditation, mindfulness tools to make your ride to the hospital to address it a whole lot more comfortable. Or you can spend the whole way screaming, I have a knife in my thigh, this is awful, my life is ruined. Either way, it's totally your choice. You always have the choice. But even in the case of much more chronic issue, you can always choose to make the journey that is your life more fun, more enjoyable. And it might be learning to do that alongside and with pain that is present. Or you can choose to just succumb to it and decide that you don't want to address it, and that you don't want to bring in these wonderful experiences into your life. It's always truly a choice, and it's always up to your capacity in the moment. And it's never, ever too late to change your mind about something either. You can always change your mind because it's our lives. We can do whatever we want. We're adults, assuming everyone listening is an adult, and we have a lot more control over our life than I think we often think we do. So there's always a way. And for me, it's really about helping people just enjoy this like wonderful, crazy life we have, and making the road as fun as possible, because life is really cool. And so why not make the best out of it?
That's a wonderful point. Absolutely. We've got to have the correct glasses on. There's no point in seeing the glass half empty, and there's so much good, so much worth being grateful for and joyful about, despite the struggles, because we all have them, right? Whether it's physical, mental, social, whatever it may be. I love that.
And
okay.
Even struggles, I just want to add one thing to that. All of those are part of a whole life. Life is not, so that's where perfectionism can sometimes be a little bit of an issue, is we have this perfectionism about, I need to be 100% pain-free and happy all the time. That's completely unrealistic. Life is gonna have pain. Life is gonna have struggle. It's gonna have grief and anger. And it's even finding the beauty in those things, and the gratitude in being like, I am feeling so much grief over this thing because there was so much love there. There's always fully feeling into every emotion that life hands us. So yeah, it's just part of a whole life. Sorry, I had to throw that piece in there because
No, it's good. It's the reality, right?
yeah.
Because we can't get away from it. It's just,
No.
and we've got to manage it. You've got to understand it. You got to know there's a part of us built for the fight flight response. When that cougar's at the end of the street, which happened to me once, and I was living in a city near here. It's like, oh my gosh, there's a cougar down there. But there's no point in living our life as though the cougar's always there, always looking at us,
Exactly.
always like, that's not the
Mhm.
point of life. It's to have the balance between the action to deal with fight flight, and then the reality of relaxation and the healing response, the parasympathetic nervous system, to help us on that journey. So, any final tips before we talk about how to get a hold of you?
Really is that I really think that last piece about having the ability to have more control over your life, including your pain, more than you probably have been even taught. So much of the medical profession, even the physical therapy, is about fixing a problem and the solution being very external. Rarely does it teach us to look internally. And because of that, oftentimes we don't know how to look internally. So having a guide, having a system, like assistants doing this and learning this brand new skill can be life-changing. So it's something that I highly encourage. If you're always looking external for a solution, start learning how to look internally.
Awesome. Okay, so you're full-time online, based in Kentucky with your family. So how do people get a hold of you to get some help?
Yeah, I'm on Instagram. It's probably the easiest place to find me, at Dr. Andrea Moore, and that's DrAndreaMoore. And you can also find me at the same name, drandreamoore.com. And on my website, there is a link. You can, if you go on it, you can book a free pain strategy session with me. It's 30-minute video consults, and we can discuss, like, I can learn more about your story and learn the next best steps to helping you on your healing journey. If you have any questions, like, again, DM me on Instagram. It's the easiest way, or on my website. Again, there's a contact form, and you can just shoot me an email as well. I love hearing from people and providing resources and any assistance I can help with.
Well, all you listeners, no excuses anymore for the doctor down the road not being able to help you. The doctor's online, and Andrea's done so many different things in her career, and also lived it. Went through it, has felt it, realized the limitations of the traditional methods, and we need to have a combination of approaches if we're going to be successful. And it's wonderful to see that. So congratulations on your journey, and I'm thrilled to meet a fellow traveler on the path of helping people heal and come back to themselves, because I think at the root, this is who we are. This is who we are at the deepest level, and we need to rediscover that. So yeah. Thank you once again. It's lovely to see you, and I welcome you back on the show anytime. We should connect up, and there's lots to talk about. And,
oh my God.
I thank you so much for being here.
Thank you. Thank you so much. It was a pleasure to be here.
Okay. Bye for now.
Bye.